coming today and providing answers to our questions. I wanted to just take a second and publicly thank VA Secretary McDonald, who told us when we met him that if he could be of service, that individually reach out. And he reached out in an emergency in my district, in the 2nd District in Indiana, with a young couple, Aaron and Eric Olson. He had been misdiagnosed at a CBOC in my district, and his health was degenerating at a rapid rate, no diagnosis whatsoever. And I called the secretary. They moved on our behalf and on behalf of this family. And he, too, was diagnosed with cancer. And they moved and facilitated him to the IU Research Medical Center in Indiana, which is very close to the VA hospital. He since has been diagnosed. He's under treatment right now, and he's beginning to improve, and there's light at the end of the tunnel. I appreciate his commitment to honor that. And to echo what Representative Walz just said, and some of my other colleagues, it just kind of adds, that kind of a scenario is good and bad. We're grateful when that happens because we just save the life of a veteran, but we can't make calls on behalf of, in my district, 57,000 veterans and their families, and it just kind of, to me, just sheds light on the fact that to all of us, and I think to our districts in America, this is still a very, very urgent matter. This is still a 5-alarm fire, and I think America is willing to give a little bit of time to say we understand the comprehensiveness of this, but I think they're going to want to see action at probably the same rapid rate that we do. So I just want to pass that along. But just a clarifying question. For those senior executives that retired during that 5-day interim period, that new 5-day period, in lieu of possible removal, they leave. Is there anything on the record to say that they were slated for removal? So there's some kind of a trail that says these folks possibly left because of that? They were at least on that list?
Whether an employee resigns or retires, the proposed removal action winds up becoming a permanent part of their file. So any other federal agency, if they were considering hiring this particular individual, would see that as part of the file.
And my other question, which again is a follow-up from many hearings we've had before, is this issue of the VA and IT. And I have a bill coming up in a couple of weeks that we're going to have a hearing on. But the new law required a technology task force to conduct a review to look at that VA scheduling system. The Northern Virginia Technology Council conducted visits at VA medical centers in Richmond and Hampton to observe the scheduling operations and interview the staff. Do you consider the results of that, what they obtained at those medical centers, to be representative of the entire system?
I think as we have gone through the findings in the NVTC report, I would say that it affirmed an awful lot of what we believe we knew already. It also reiterated a fair amount of information that was part of the Booz Allen Hamilton report that was done back in 2008. I think it was useful and very helpful. It's an independent point of validation in many instances. The point that came up that Dr. Rowe mentioned earlier about the need for treatment rooms. That was one of the things that showed up in the NVTC report. That had anything to do with the scheduling system. Basically, they were looking and saying, one of your obstacles to providing access to care is you got medical facilities here that only have one treatment room per provider. We're never going to make optimal use of our providers when we've got that kind of constraint operating.
Can I just follow up real quickly before you answer? So that 2008 report, it's 6 years later now. Have all of the issues been addressed in that 2008 report as far as inconsistencies and recommendations?
You mean from the 2008
report? If it paralleled.
No.
So why haven't they, if it's been 6 years?
Well, you may or may not recall, that was a report where there was questions were asked back in May with other individuals sitting here about the report, and by and large, the comment was folks were not even aware of the existence of the report. I had not been, of course, I'd only been here for 3 or 4 months, but that report got issued, and basically it went in somebody's desk drawer.
Right, but as you recall, in some of the hearings that have gone on only in the last 2 years since I've been here, there were lots of information given to this committee that there was no problem whatsoever with the scheduling system with the VA. Nobody ever said it was a 1985 system. The gentleman in charge of your IT system sat right there, and when I said, do you have everything you need, resources and money, and we're good to go, the answer was an overwhelming yes, even during the budget time. So here we are now, 2014. The Boozman report was out there in 2008. There's a mandate in this new law. Where are we with the scheduling system and this whole idea of mandatory compliance now?
Yeah, the Booz Allen report went far beyond the scheduling system, as did the NVTC report.
Right. But where are we specifically on the scheduling system?
Specifically on the scheduling system, 4 different tracks, I'll call it 3 different tracks of work that are underway right now. A whole series of patches to the existing system. We're on the tail end of that. Probably within the next couple of months, we will have completed all those patches. We've let a contract for major enhancements to the existing scheduling system. Those are supposed to start coming online in the spring of 2015, so a near-term solution. Those also include creating the ability for us to field some apps that have been created that will actually allow veterans to request appointments, and one of the other apps actually allow veterans to directly schedule an appointment, but we've got to have the ability to catch it when the veteran sends it. And then in parallel, and we think we are literally a matter of days away from a contracting action for the acquisition of a commercial off-the-shelf, state-of-the-art scheduling system. Now, that system in all likelihood won't be up and running until sometime in 2017, which is why we're doing these other things in the meantime. I should indicate, though, and it's reaffirmed in the NVTC report, the schedulers that they talked to in the field said the scheduling system isn't the impediment. It's the lack of appointment slots. They basically came back and said, well, schedulers say it's okay. We know it needs to be replaced.
Right.
We know it doesn't provide the functionality that we need to have, and so we're pressing on to get that done. But that's not the obstacle from the scheduler's perspective.
Thank you. I yield back, Mr. Chairman. Thank you.
Thank you. Ms. Titles, you're recognized for 5 minutes.
Thank you, and thank you all for what you've been doing to try to fix these problems.